So when we're taking care of patients in the office, we try to take many different factors into account to help figure out what their problem really is and how much it's affecting them and what we can do to help them down the road. Sometimes that's lab tests, sometimes it's x-rays or MRIs. Part of it's also the conversation with the patient that we have during the interview process. And really there's specific questions that we're trying to ask in a structured format in conversation to help us figure out how is this really affecting the patient, how much functional limitations do people have, how much pain do they have. The reality is that while we may be successful as individuals in capturing that information in that manner, it already exists in structured surveys that have been validated externally for specific conditions that we can apply ahead of time. We then ask patients to fill out surveys prior to a visit or before or after an intervention like surgery. And these validated forms result in a score for that patient on how are they doing with regards to their mental attitude about their issue that they have, their pain that they're having, how much functional limitations they have. And then we get really a quantitative score on how they're doing in those categories. That helps us understand what is their chance of having a benefit from a certain treatment, potentially what is the risk of the treatment for that patient. And then also, after an intervention like a surgery, we can say you're doing better than 25% of people that had a rotator cuff repair done 6 months prior to this visit. And so we start to get very granular in the data that we can have in the conversations in the office. And so really having this information, that survey information through what we call patient-reported outcomes, helps round out the conversation with patients and physicians in a more objective manner that we can put numbers to different aspects of how somebody is recovering or feeling from a condition, and then make interventions specifically tailored towards their issues that they're coming in with.